I like that idea of a series of changes versus one change if I'm just going to try harder. And you and I, as we're talking through an analogy of between quitting smoking and buying a house.
Well, just to take the analogy one step further, if you treat quitting smoking like a decision in the moment,
Right.
it's like having cash in your pocket and going door to door looking for a house to buy. It really doesn't. It's not a strategy that's going to get you a house that you want. Really looking at it as part of an important life change plan that you develop that's tailored right for you. Finding the right priced house, the right size house, in the right place is really similar to finding the right smoking cessation plan that fits for you and addresses the things that you need in your life: stress reduction, social time, that smoke break with your coworkers. Mm-hmm. These things have to be replaced in a way that works for you, and
that's I think the message you're trying to put out there is that's going to be different for everybody. Yes. So everybody's smoke cessation plan is going to look different, have different components. Where I like to start with folks when I'm working with them on this is really just have them kind of be honest about their current motivation. So I use a scale from 0 to 10, and I ask them to rate themselves. 10 is, where they're super duper motivated. In other words, there's nothing else in the world that's more motivating to them than quitting smoking right now. And that's, no one ever tells me honestly that they're a 10. So we don't expect that. And 0 is they have no motivation whatsoever. And some people do have a 0 motivation coming in. They're just not something they're really interested in.
Right.
And that's fine. The important thing is to be honest about what number you are to start with from 0 to 10. And then the next question you ask is, well, let's say you're a 4. What would make me maybe have more of a 5 or 6 level of motivation?
Right.
And that's where you start looking at barriers or obstacles to making the change. And you've mentioned some already, including stress reduction, the fact that smoking actually helps some folks socialize. Say if they're used to going, for example, to the local tavern, and smoking is just kind of a way to keep your hands busy and connect with other smokers. There are lots of ways in which smoking becomes a really integral part of your life. And I think it's important for folks to respect that. Respect that smoking is actually an important part of my life. And of course, we always talk with folks about setting quit dates, but we talk about quit dates only when a person is at a sufficient level of motivation, right?
Right.
Because it doesn't make sense to use the analogy we've been working off of to prematurely make a decision about a house.
Right.
Because then you get kind of buyer's remorse, you get into kind of situation that's hard to get out of, and you feel a sense of failure about it. So it's important to kind of have a sufficient level of motivation, then set a quit date, a date at which your plan is in place to deal with the obstacles and barriers. You've talked it through with your primary care provider, you have your kind of team of people, a support network that's helping you with it, and then you make the change at that point. So let's say someone walks into the office, says, man, I had 2 weeks straight, I was doing great, and yesterday I had a couple of cigarettes.
Well, I'd say it's a moment of celebration, actually, where I would have them really celebrate the 2 weeks that they had as a step toward what they want to become, a smoke-free person, and talk about what it was like for them, trying to identify some of the things that were positive, and also help them understand that, like a lot of other changes that we make, it's revisiting the change and reformulating plans when you have unexpected outcomes. And if you lack that understanding about change, that it's one step forward, one step back sometimes, then you can really get the wind knocked out of you when you have that setback, that normal setback. And that can really zap out your motivation, and then you may have had an 8 on the scale, and then it becomes a 4.
Right.
Because of this misunderstanding of how change works.
So there's tons of methods out there, but I think our key point here is that it's not so much the methods, it's the combination of methods combined with your willingness to work on the issue and deal with your motivation
tied together. The more you work on it,
Yeah.
the more you work on your plan, the more motivated